Dr. Carl Jung once said that technology is neither positive nor negative. It is neutral. And I would agree with Dr. Jung. But for the next 14 minutes, I want to share with you some of the truly transformative power that virtual reality has had for the last 20 years in my best teachers, my patients. Stephanie was a typical 18-year-old excited about going off to college for the first time and excited that her father had taken off work to go with her. In a split second, her life changed forever. Stephanie spent the next 2 hours getting removed from the wreckage of her vehicle by the jaws of life. But she was lucky, she survived. Her father didn't. He was killed on impact. After 18 months of multiple operations, Stephanie's physical wounds began to heal, but the invisible wounds started to manifest themselves. She had post-traumatic stress. So she came to see us at the clinic with one small goal. She wanted to be independent again, and she wanted to drive the 15 minutes each way to her physical therapy appointments by herself. When we first got Stephanie at the clinic, we trained her how to control her physiology, her heart rate, her respiration rate. We trained her how to control her thought processes. Then we put her in the virtual reality after she had that skill set so we would not re-traumatize her. The first day, all she could do is sit in the virtual car. She couldn't turn on the ignition, she couldn't drive. But we slowly and systematically, at Stephanie's own pace, went through the virtual scenarios, and she not only achieved her goal of driving herself to physical therapy, but she drove herself wherever and whenever she wanted to go. She went back to college and attained her degree and is now living the life she was meant to live. That is the power of virtual reality. Virtual reality wasn't invented by us, and it wasn't started 2 decades ago. It actually began in 1968 with the first head-mounted display invented by Ivan Sutherland at MIT. We began using it 2 decades ago to treat phobias, eating disorders, other anxiety disorders, autistic children. It was not great. The virtual reality headsets caused neck strain and eye strain, but they worked, and that was the exciting thing. We started to improve it by having augmented reality. We had airline seats in the clinic. We had car seats in the clinic. We were able to add more things so people got what we call immersed or present in that world. So no longer were they sitting with me in my office. They were transported to another dimension, another reality, and able to deal with the situations they were afraid of. But this is what you probably know of virtual reality. In 2014, Facebook bought the Oculus head mount display for $2 billion. And this is going to be the game changer. With this purchase, with Samsung and Sony and Microsoft getting new head-mounted displays, the price has come down dramatically. And this is now going to be available to the average clinician, to the consumer. So we are going to now be able to take what we've been doing in the clinic for 2 decades successfully and translate that and put that power in the hands of the patients so that they can get anytime, anywhere care. We've done this in small studies already with chronic pain patients. So we start the virtual reality in the hospital, in the office setting, and we translate that technology and those skill sets over into the patient's home, into the office setting, so they have 24/7 pain relief. When we put a person into virtual reality, what are we trying to do with that person? What we're trying to do is confront and correct. So if a person comes in my office with a specific phobia, they might say, I'm in control, I'm fine, I know logically that flying is very safe. But when I get on the airplane, I freak out and I'm out of control. And I say, I am going to put you in total control. I'm going to teach you how to control your thought processes. I'm going to teach you how to control your physiology. And I am going to let your subconscious chip away at that fear structure. I'm going to put you in that virtual world, have you practice skill sets, help you improve your self-confidence, your self-efficacy, and really understand truly on a subconscious level that goes into the consciousness then that flying is safe. We've done this over and over with people, and the true power of the virtual reality is you can do that at the patient's own individual pace. We do this by measuring their physiology in real time, their heart rate, their respiration rate, their sweat gland activity. And by doing this, we can see as a clinician when we need to speed up therapy, when we need to slow down therapy, so it's more efficient and more effective. We can also show these numbers to the patient and empower them because they go, wow, I am in control. I came in looking like this, now I look like this. I can control my physiology. I can control my thoughts. Now let's switch to another phobia. A lot of us would be very afraid to go into an MRI machine because of claustrophobia. Some people even have to have general anesthesia because of this. So I was referred an 83-year-old lady that could not go under general anesthesia because of comorbid medical conditions. She came to me, had never taken an elevator in her life, so the thought of going into an MRI machine was overwhelming for her. We taught her those same skill sets. She was able to get that life-saving test, and she now also goes into elevators. But the thing I want to tell you about this patient is she brought her 8-year-old grandson with her. He said, can I try on the headset? I said, sure, what do you want to do? He said, I want to go on a flight. So I put him through a virtual flight. He immediately started looking around 360 degrees. He stood up, he looked over the seats in front of him, and he saw 2 magazines. We had had the virtual reality for 2 years, and we did not know the graphic artist had put magazines on the front seat. So it took an 8-year-old. But it shows the power of thinking outside the box, being creative and inquisitive, and really looking at the amazing discoveries you can make when you do that. Now this is Kevin. Kevin came to us because of a severe fear of flying. And his reality was not my reality. So when he went into the virtual world, he smelled coffee, he saw a flight attendant walking down the aisles, all sorts of things that were not truly there. But when we go into the virtual reality, we bring our own gestalt. So our own history, our own feelings, our own reality. Our brain fills in the pieces and creates its own reality. And that is the power, because the patient fills in what they need to fill in. And so they get immersed, they get present, and they're able to move through that emotion in the virtual reality. Now, this is one of our most recent cases. Gunnery Sergeant Sanchez had been on multiple tours to Iraq, and she got over all the trauma by herself, except the one thing that kept her up at night and caused nightmares was the specific clinking sound as the AK-47 rounds hit the metal turret on her armored vehicle. She couldn't get over that on her own. So she came to us because she really couldn't recreate that in the real world setting back in San Diego. But in the virtual reality, we were able to recreate that specific clinking sound as the AK-47 rounds hit her metal turret. We were able to put a sun lamp in the room so she felt that heat beating down on her. We were able to put a small fan blowing wind on her face as her armored vehicle went through the streets of Iraq. And she said, I'm back in Iraq. Now, in post-traumatic stress, we often have fragments of memories. We need to consolidate those memories, do the emotional processing, and move through those memories. And that's what Gunnery Sergeant Sanchez was able to do. She's now enrolled in college and going on with her life without trauma. But as exciting as this is, it's even more exciting when we move this far forward. So Commander Rob McGlay actually took a system to Fallujah. And what we know is with acute stress disorder and post-traumatic stress disorder, when you put a person into the system, when you do the treatment, when they've just gotten that disorder and it hasn't set and hardened in their mind, you have a more likelihood of treatment success. And this is what we have found. Now, we've worked with elite athletes, we've worked with medical personnel, military and civilian first responders, and with phobias and anxiety disorders and chronic pain. But what else can this be used for? Well, it helps us to help people that we thought maybe had a disability. You can put an autistic child into a virtual environment and teach them how to cross the street safely, how to order at a restaurant, or how to meet at a safe place if their house is on fire. And they retain these skills 6 months later when they're retested. And the powerful thing with this is whether you have an elite athlete or whether you have an autistic child, you want to involve them in the development of that virtual reality, and that brings about the power. In this case, the autistic children chose Buddy the dog to be their guide in the virtual world. Virtual reality can also be used for empathy. Oftentimes, schizophrenics have auditory and visual hallucinations, and their caregivers, the healthcare personnel, and their family and friends don't know what they're going through. But when you put those family and friends into the virtual environment, they can experience that auditory, that visual hallucination, and understand for the first time what that person has been dealing with. And it brings about a sense of empathy in a way we couldn't do before. We've also seen this with panic disorder patients. I often have patients that come and say, my husband, my wife, they don't understand what I'm going through. I go to the emergency room because I'm having a high heartbeat, I'm dizzy, I'm seeing blurry vision. Well, some of those same symptoms happen in a heart attack, and the person thinks they're having a heart attack often. And so their family member doesn't understand, and they say, just get over this. But when you put that family member into the virtual world, and you have the screen start going blurry, you have them get a dizzy sensation, the really loud heartbeat, then they start to understand, okay, this is what they're going through, and it truly builds a sense of empathy. So we've been using virtual reality in the clinic for the past 20 years very successfully. But what does the future hold with the techniques like Oculus and Samsung and Sony? What we do now is translate those skills into the real-world setting with virtual reality, mobile devices, and wearable sensors. And we did this actually with teachers and nurses. It was a study funded by the European Commission in Belgium, where I live part-time. We actually had them do the same skill sets in the real-world setting, in the virtual world, in the clinic, and then we had them take things home on iPads, iPhones, and with sports watches. And they were able to translate those skill sets learned in the clinic, keep doing them on their own at home, and the people that got the technology to try at home actually had better self-efficacy and an improvement in their stress management and their burnout, better than the people that just did the treatment in the clinic. So the power of technology is going, again, to be translating this technology and this treatment into the home setting and letting patients help themselves in the future. This is its power. This is my passion. Thank you.